Hello, I'm Dr. Rohini. Today I'm going to tell you how often you must visit our hospital when you're pregnant. The pregnancy period consists of around 40 weeks. A pregnant woman is expected to visit the hospital at least once in 4 weeks, up to 28 weeks of her pregnancy, and after 28 weeks, at least once in 2 weeks till 36 weeks. And after 36 weeks, when she is close to the time of delivery, we expect to see the patient once in a week. Our hospital is specialized in seeing infertility patients. So usually all the infertility patients who conceive either by intrauterine insemination or IVF, we tend to see them a little bit more frequently in the first 3 months. This is because usually the chances of abortions, that is pregnancy loss, is more common in the first 3 months. So ideally in before 12 weeks, we see the patients once in 2 weeks, and at that visit we check whether the patient's blood pressure normal, the weight gain is adequate, and we also do a scan to see if the baby's activity is good. So this is how common we expect to see you. But in case if you have any other risk factors, in case if you had previous pregnancy losses, if you have diabetes, hypertension, or any bleeding during pregnancy, in these cases we expect to see you and more frequently and monitor your pregnancy more vigorously.